Okay, I'm here with Dr. Sunjya Schweig. We're here on the next edition of How I AI with Clinicians. First of all, I'll just say you are very accomplished, functional, integrative, longevity doctor. You kind of do a mix of these things with your practice, and not only are you really accomplished doctor with your own practice that's successful in the Bay Area, but you also are a constant experimenter and kind of really at this bleeding edge of testing all the different technologies around AI, all these different tools that are coming out, and figuring out how you weave them into your practice. So I'm excited for you to share today some of the use cases that you're finding most interesting with a variety of the tools out there.
Yeah, thanks, Sunita. Thanks for having me on. And yeah, it's a pleasure to be here. And I think I appreciate that introduction. I think that's right. Just always curious, always experimenting, and just really enjoying this time of being in medicine. I've been doing functional medicine my whole career, and really, health span and longevity has been a big part of what we've done, personalized care, and now this whole tech overlay and the AI piece. And I've always been really passionate about data and data visualization and symptom tracking and wearables. And we were using the Aura Ring in 2016 with our firefighter wellness programs. The first generation Aura, where it was this huge like knob of a ring, and but
Yeah.
the data and the bringing the data in, bringing symptoms in, bringing and then kind of overlaying that with our patients' care and our wellness programs has always been a passion of mine. And I brought that forward in our practice, and also in companies that I'm advising and working with, and just like it's such an exciting time, and just love what you guys are building and what is happening in this space, and really find it invigorating. And I think that from what I'm looking at, we're very bullish on AI. I think there's a lot of potential pitfalls. There's a lot of areas of concern. There's a lot of areas of caution. But I think that some of the gains and some of the value adds are going to be huge. Just like the
Mm,
basic use case of how data comes into our system, into our EMR, and what I have to do currently to get through that data and parse it and understand it and look at it and open PDFs and close files and click here, click there. And so like one of the cool use cases that I came upon recently was patients. I have a few patients who are also very AI forward, and sure, yeah, using AI, it's not private if you're on these commercial systems, but some people
right.
have decided that it's more important to me to have all of my records in one place and to be able to manipulate that data and ask questions of it. And so people are we're not doing it. We don't do anything that's not HIPAA compliant, but my patients are sometimes coming in having put all of their records onto ChatGPT or put all of their records onto Perplexity. And I don't advise them
Yeah.
to do this, but if they do it and it's all there, that's a very interesting use case. And so, during a visit recently, I was kind of like looking through my information, and the patient said, well, I have all my records here on Perplexity. And I was like, hold on a sec. Okay, let's do a reverse screen share. Why don't you share your screen and go to your Perplexity project with all of your data and let me start asking questions of it. Right. And so the patient was actually thrilled.
Fascinating.
Right. He was super
Yeah.
thrilled because he's like, really? You want to do that? That's so cool. Like, I want, because like he wants interaction with his data. He wants answers. He wants trends,
Yeah.
and so we were just, talking back and forth during our Zoom meeting with his Perplexity project, right? Where he had all his data and getting insights out of it. And he was learning from me and just sort of like how my brain works and how I'm thinking about questions I want to ask. And I was therefore able to, see some of this potential that we're all excited about how can we bring data to life using AI and basically like chat with all of our data, chat with our chart, chat with our genetics, chat with our labs, et cetera. So it was really fun.
So, first of all, I love this use case because I think it's such an interesting question. Now, you have people who are coming in equipped with so much information, and using these tools that are very accessible. And I think there's a community of providers who are like you, who are like, cool, bring it on. Let's like figure out how to work with this. And then there's also, a number of providers who might feel threatened by that. And just as, kind of when people started Googling things and, I'm sure there's just elements of discomfort there because there's now just this tool that you might have less familiarity with. So tell me, first of all, just like break down what was it like for this person to bring this up with you in the first place, and how did you embrace it? It sounds like you were very open to the idea, but tell us more about just how that went down.
Yeah. So this is a person who is very, proactive about their health, and someone who I work with, I have for a period of time now, and someone who's seen a bunch of other doctors, someone who travels internationally. They spent time abroad, even in for example, in Dubai, and So they had like a lot of opportunity to get different studies done in different places. And so he
Mm.
had a lot of data and he was very organized. And so he had all of his data in folders and, available to him because he's tracking all these things on his own, right? Because that's what the proactive health consumer has to do. They're silos. So they have to basically pull it in. And so he had his, and then from those sources. So he was basically showing me folders. I was asking him, well, what, I think it was around thyroid. When was the last time we checked this and this marker around your thyroid? So he was like digging through his folders and, kind of like in that old school, V1 version one way that we've been doing things. And then he's like, yeah, well, I have all these in perplexity. We had talked about that before. I was like, okay, hold on. Yeah. So that's kind of what transitioned us over to that.
Yeah, no, go ahead, go ahead.
Yeah, so I have another patient who's very similar. And actually, when we did our presentation at IFM last June, and we were on stage together, I presented this use case also. But a patient who similarly has put all of her records onto ChatGPT and is interacting with her records there to the point where she's actually given this instance of ChatGPT a name. She calls it Jerry, and she will actually writes to me frequently now. Jerry says so and so. Jerry says so and providing sort of input from what her instance of ChatGPT has said. On the one hand, there's a lot of really cool and exciting stuff, and on the other hand, yeah, there's some things that are errors and some problems and some things that I felt like Jerry had misinformed her, right? And so we go through that discussion also, even to the point where during a visit, I brought up my instance of ChatGPT and I said to her, okay, you have Jerry, I'm going to use mine. I'm going to call it Sam after Sam Altman, right? And so now the visit was like patient and me and Jerry and Sam, and we're all having this like discussion. It was
Doubled, yeah.
fascinating, right? So it's an opportunity for me to like, applaud her and support this kind of use case for both these patients, but also educate and say, okay, there's a lot of benefit here. There's a lot of really cool summarization of data and trending and questioning and
Mm,
we can ask, but there's also like we don't always know these answers are accurate. And so
yep,
we have this concept of human in the loop or doctor in the loop, and we have to have all these voices together, right? And so we can't
yeah.
just have one or the other, or things might be dangerous. So
Well, what's so interesting about your examples here are the fact that one, it sounds like these patients are excited that you are engaging
yeah,
with this data,
yeah,
like, and not just kind of poo-pooing it and saying, it kind of first of all builds more trust in you as a provider. I'm sure to know that like you're willing to work with all of this, and then two, you're teaching them something too, which is, obviously you're teaching them a lot of things, but the point that you can bring Sam into the picture, who's saying different things than Jerry, even if they're both chat GPTs, that actually has a lot to do with how have you trained Sam? How are you prompting Sam? What questions are you asking that are
yeah.
coming from your brain that are only things that you know as a clinician? And so these are such powerful tools, but they're also only as good as the users of it, right? Like if layperson is digging in on a lot of this data of whatever you might be looking at around labs and things, you probably won't get the same output as if you, as an expert clinician, are digging in and asking it and getting to certain things.
Yeah, I love that. And the clinicians have to be also careful about how we, and think through it and interact with it, because if we're being fed a lot of information from AI, I think there's always going to be times when some of that's going to be beyond our knowledge base. So, beyond an area of expertise that we have, right? Because there's so much to know. It's endless, right? And so I think, we always have to be careful about cross checking and making sure we understand. I love, the what I call medical grade AI platforms for this, like Open Evidence and Consensus and Future House, et cetera. And also the technique of taking an output and putting it into a separate chatbot and saying, "Hey, tell me what's accurate here and where the gaps are and where the holes
Mm.
are, and like flesh this out. Do you agree with all of this?" And so if you play them off each other, that can be super helpful.
That's an amazing technique. Like we do that actually a lot in, building products, which
Uh
is
huh.
and evaluating things, but we call it LLM as judge, kind of
Cool.
using the LLM to evaluate the output of things. And so you can actually use that same technique in just evaluating the outputs you're creating.
Is that something you can build into like just a workflow that it always does that? It always does a comparison.
So in terms of like evals of our system and ways that on the back end we're doing evals of how the output of a chatbot or any kind of AI function in our system works. There's generally, I think, a lot of people who build products like ours or others will use this concept of LLM as judge to evaluate the output, which otherwise you're also doing like human evals often, and that is something that should be done in parallel. using both of these things will get you better output. But yeah, it's essentially doing exactly what you're doing. So
Mhm.
it's a very similar thing.
Nice. Cool.
Yeah,
Yeah, no,
yeah. So you're doing
so
it.
those are a couple of fun use cases. I've also had a really fun time recently. I've been enrolled in a Stanford class in AI and longevity and just building tools, building, a custom GPT. I built one called Strength for Life, which guides people through 5 different body weight exercises that are really important for health and longevity. So things like push-ups and lunges and squats and tricep dips and crunches. And so we did like a deep research and filled the back end of this GPT with really, really long documents based on these exercises, what muscle groups they feed and support, and how that's important for health span longevity and molecular pathways, and then also, what happens to you if you are doing it wrong, or you have the wrong form, or you
Mm,
start having pain, and what the regressions are, and how to slow it down, or how to make sure you have the right form. So the GPT will actually check you on that, and so it's been kind of fun playing with that and using the voice interface with ChatGPT on the back end of that, and having it guide me, because I've actually been trying myself to do all these exercises, do 100 reps every day, and I've been good with my push-ups and some of the other ones, but lunges I started to have some knee pain, right? And so then I had to
mm,
say, okay, I'd start talking to this GPT and asking it, hey, I'm having knee pain, talk me through the right form. And so I could have this voice next to me telling me all the specifics of the mechanics of a lunge, and so that was actually super helpful. And so now I'm able to do lunges
cool.
again without having knee pain. So that's awesome. It's something we're going to be not sure exactly the timing of when this talk with you and I will go up, but when we're at A4M, I'll be speaking with Lexi about this, and so I'm hoping to demonstrate this live. Maybe get the little teaser, maybe get the whole crowd doing some squats or something. So we'll see.
Some squats with the right form. Awesome. Yeah, we'll try to get this out before then. So this is kind of a nice preview for some of the content coming up. What is it? What's your session called at A4M?
It's a Saturday afternoon, I believe, and clinical applications of AI. I think that's the title.
Cool.
I have to check the exact title. Yeah,
Course. Yeah, yeah, yeah. Well, people will know where to find you and some of the
yeah.
topics that you're going to be touching on, which is great. So, one last question I have around the kind of vibe coding concept is, how do you think of like when it makes sense to vibe code something? So there's a lot of like fun, interesting ideas. It takes time. There's not always time to play around with things like this. So if you were kind of trying to share some guidance with all the clinicians out there who are thinking about where to get started, how would you help people think about vibe coding and where to play around with vibe coding?
I'm pausing to how do I say this best, but I think that everybody should be trying it, period. And just get in there and just try it out. And it sounds maybe a little bit intimidating because it has the word coding in there. And it's like, I personally have no coding background, like never coded,
Hmm.
never took a coding class. It all looks, quote, Greek to me, right? So,
Right.
just briefly, what is vibe coding? It's basically, you can chat with these platforms and you can just give it instructions in plain language, and it builds the code on the back end and gives you a prototype to try out.
Yeah. Yeah. Exactly. Exactly. So
And so
it
then,
kind of
what you
can
can do is
bring.
you can just iterate from there, right? And so you can
Yeah.
literally play around with, see what the output is, and yeah, something works great, something doesn't work. You say, "Hey, fix this," or it throws you an error code. You can literally screenshot that, put it in ChatGPT, and say, "I was vibe coding this on Lovable or on Replit or on Bolt.new, and this is what happened. What do I do?" And ChatGPT or the vibe coding platform will tell you. And so now the caveat is that it's not perfect. It's not amazing, yet. It's not like that's going to replace if you want to build something super robust that's really, very technical, or, it's not going to do that for you at this point. But just the experience of getting in there, tinkering, understanding how these tools work, understanding how AI is serving this new opportunity up to the mass public, I think that's critical for everybody. And I think that the take home message that I talk about, at conferences when I speak on this topic is that don't be intimidated. Just go in and try things. Learn how it works. It'll spark thoughts in your brain. It'll move you from this place to that place. You'll keep iterating. And then basically what you're doing is you're just staying on this wave that we're all experiencing right now. And, because I think everyone should get on the wave. I don't think the wave's going
Yeah.
anywhere. And I think we all need to be learning about it. And, I think people worry about AI job displacement. Maybe or maybe not. Will we be replaced by I don't know, maybe. But I think you will probably be replaced by somebody who does your job, but also knows AI. right? And so
with AI.
you
Totally.
can't, you have to know, you have
Totally.
to be able to do both, I think, going forward. And so just get in there and try it and don't be intimidated.
Yeah, I love it. I love it. That's great guidance. I mean, I think some of the things to be, kind of aware of in vibe coding, especially when you're doing it in health context or anything with patients, obviously, there's a spectrum. There's a lot of things like getting in and doing it, build personal apps for like your life or things like you're doing, like stuff around fitness and stuff. There's obviously more complexity when you start to deal with like, using things that need to be HIPAA compliant,
For
et
sure.
cetera, or even like just well designed like interfaces, right? You'll create
Yes.
a vibe coded interface and like it's kind of just like very
Generic.
basic and you can give it more guidance and it still is like pretty basic. But those are probably some of the shortfalls. But it gives you, like you said, a great picture of like, oh, this is how this works, or maybe even a new way to think about how to do things. So yeah, those are tons of great guidance there.
All right, one last thing. I have a colleague who has launched a platform called drvibe.ai, so people can check that
I
out.
just spoke with him this
Oh, cool.
afternoon,
Fadi.
actually. Yeah,
Oh, cool.
Fadi. Yeah, literally, like right before speaking with you. That's so funny. I'm gonna have him on soon. Yeah,
Brilliant.
that's so funny.
So yeah,
Yeah,
so I'm gonna start playing with that. I just got into the platform to check it out. But literally anyone can go to Lovable and just start typing things in and see what happens and play with it and just iterate and check it out. I think that it's just a fun experience. It's just exciting. So don't be intimidated.
yeah, love it. So, bottom line, don't be intimidated. Get started and embrace these things. So thanks so much, Sanjay. Really awesome to have you on and to get your thoughts as always.
My pleasure. Great to see you, Sunita, and we'll talk soon.
Thanks.